So for anyone who's ever had a scar, I'm sure you've experienced some itching around, and you're always wondering what is causing this. So itching is a common and normal part of wound healing, especially if it's just days or weeks after surgery. And here is why wounds itch. One, it's because the nerves are regenerating. So when your child has had surgery, tiny nerve endings in the skin are cut. And as the wound heals, those nerve endings begin to grow back and try to reconnect. This regrowth can send random signals to the brain, which are often interpreted as itchiness instead of pain. The second is the histamine release. So as part of the body's natural healing response, histamines are released in this area. So histamines are chemicals that are produced normally in our bodies. So these chemicals help with inflammation and tissue repair, but they can also cause or trigger itching, just like what happens when you have an allergy or a bug bite. The third cause of itching is dry skin and scabing. So as a wound heals, the skin around it will become dry or a bit flaky. These scabs also shrink and they tighten as they dry out. This can cause that tightness or itchy feeling, like the skin is pulling just a little bit. Another is that it's a sign of healing, but watch for infection as well. Itching usually means things are going well, but if the itching comes with redness, warmth, swelling, if there's pain, pus, those may be signs of infection, and you could call your doctor as soon as possible. So how do you help your child cope with itching? So don't let them scratch. And I know the instinct is to scratch. Scratching can reopen the wound or introduce bacteria into the wound. Keep the wound clean and lightly moisturized if that's allowed by your doctor. Try to use cool compress or ask the doctor about safe anti-itch creams if that's really bothering your child. Another is distraction. So things like music, games, gentle massage away from the wound can help take the itch off their minds.